What if your toughest patients aren't resistant, they're just misdiagnosed at the root? I'm Dr. Arwen Podesta, functional integrative psychiatrist, triple boarded in adult psychiatry, addiction medicine, and forensic psychiatry. I help addiction professionals improve patient engagement and recovery outcomes using integrative, evidence-based strategies. In this video, I'm going to share the tools that make that possible. Here's an issue we're facing in the addiction care, one that even experienced clinicians can overlook. Look, we're trained to assess symptoms, we prescribe based on protocols and biochemistry, we track progress through behavioral checklists, and while that can create short-term wins, it sometimes fails to create real momentum. Because what we're seeing on the surface, things like mood swings, impulsivity, lack of motivation, that might not be the whole picture. It's the output of a deeper loop. And if we focus only on that output, we miss the structures driving it underneath. And that's why so many patients get stuck. They might be doing all the right things, attending groups, taking their medications that we're prescribing, working with case managers, but they still might feel dysregulated, foggy, or just off. Eventually they disengage and then relapse. Not because they're unmotivated, not because they have a character flaw, not because they're resistant, but because the interventions we're offering are only skimming the surface. If we don't shift from symptom management to systems-based recovery, we end up reinforcing the very cycles we as providers are trying to break. And that's where functional psychiatry comes in. All right, so let's look at what this could look like in a practice. I want to get into a hypothetical patient. Let's call him James. James is 34 years old, just finished residential treatment, doing what looks like everything right. He shows up to your IOP. He's taking his medicines as prescribed. He's starting to reconnect with his family, but something's off. He's dysregulated. He's agitated. He zones out during group, and he keeps mentioning this weird feeling wired, but also tired, like his body's on edge, but his brain can't focus. You adjust his medicines, you encourage more structure. He tries, he really does, but after a few weeks, he gets overwhelmed, and that creeps in more and more, and just like that, he relapses. Now on paper, it might look like he's someone who's not ready or he's struggling with insight, and we might have written that down on the chart. But what if James actually isn't emotionally avoidant or treatment resistant? What if his body, his biochemistry is driving this dysregulation? What if he's dealing with blood sugar spikes and falls that show up as anxiety, or he has chronic neuroinflammation that's disrupting his sleep or his mood? What if his system is under-resourced and we're asking him to do recovery work without his biology being supported? And when we start to ask those questions, we open up a whole new clinical map, one that doesn't blame the patient, but equips them to actually heal. So what do you do with a patient like James? How do you support someone who's engaged but dysregulated, who wants to get better, but keeps getting pulled under by forces they can't really name? This is exactly where functional psychiatry comes in. Functional psychiatry or functional medicine isn't about reinventing the wheel or throwing out your current tools. It's about zooming in so you can see why the system is breaking down in the first place. Because when we treat addiction as just a behavioral issue or a chemical imbalance, we sometimes miss the deeper pattern. But then when we look deeper and ask, what are the biological, the psychological, the environmental structures underneath his behavior? That's when things can shift. In patients like James, we often see 6 key areas that drive relapse, stagnation, or chronic dysregulation. And these are the root domains that I come back to again and again in my work. First, neuroinflammation. When the brain is inflamed, it's not just a physical issue, it's changing everything. Your mood, your memory, irritability, impulse control. If we're not calming down that inflammation, we are fighting an uphill battle. Second, blood sugar instability. It sounds simple, but those glucose spikes and crashes can feel like panic, can look like cravings, fatigue, mood swings, and more. And if your patient is skipping meals or living on processed carbs and sugars, their nervous system is already working against them. Third, nutritional depletion. Substance use depletes key nutrients that are necessary cofactors like B vitamins, vitamin D, magnesium, zinc, omegas. Those are essential for brain function. Those are essential for physiological detox and essential for emotional regulation. And without these, recovery becomes harder than it has to be. 4, gut-brain disruption. The microbiome doesn't just affect digestion, it impacts neurotransmitters, including serotonin and dopamine, inflammation, decision-making. When the gut is off, the brain follows. And 5th is hormonal imbalances. Wow, we often overlook hormones like cortisol, like thyroid, testosterone, and other sex hormones. When these are dysregulated, patients may present with fatigue, with mood swings, insomnia, anxiety, even treatment noncompliance. Sometimes they're trying to self-treat these symptoms that are off because the hormones are off. And we chalk it up sometimes to psychological resistance. A huge one, not to be forgotten, is unresolved trauma. Not just what happened to the person, but how it lives in the body. Because we know very well that trauma changes the stress response. It rewires the reward pathway. It makes recovery feel unsafe, even when everything looks fine on the outside. Now, when you start addressing these 6 root causes gently, gradually, in a way that honors the whole person inside and out, patients have the ability to start to stabilize. They feel clearer, calmer, more resourced. And what once looked like non-compliance or self-sabotage starts to make sense. Functional psychiatry doesn't just give you more data, it gives you a deeper map, one that can guide you back to the structures that support real, lasting recovery. If this sort of perspective resonates with you, if you're finding these insights valuable and want more content like this, like my video, subscribe to the channel. It's the best way to make sure you don't miss the next strategy that could shift your clinical outcomes. So now that you know the 6 key areas, how do you actually bring this into your clinical work? How do you begin to apply functional psychiatry principles without turning your practice upside down or without stepping outside your scope? Good news is you don't have to change everything. You just need to change what you're looking for. Change your mindset a little bit, because once you start spotting the patterns, those underlying root causes, you'll naturally begin to ask clearer questions, make more precise referrals, and guide your patients toward deeper, more sustainable healing. Let me show you how this looks in real life. Start by expanding your intake lens. When you're doing that initial assessment or the subsequent few in the beginning, go beyond just substance use. How much, when, what. Go beyond psychiatric history. Ask about digestion. Ask deeply about sleep quality, not just number of hours. Ask about energy crashes and fatigue throughout the day. Ask if maybe they feel foggy after meals. Ask if they've had major life stressors or infections that might have preceded their substance use. And these questions are quick, but they can open the door to powerful insight. Then don't forget to order labs. If you're not already doing this, let's get some foundational panels. Include a CBC, a CMP, CRP, thyroid function, some vitamins, fasting insulin, and maybe a further basic nutrient screen if that's available. And these aren't really extras. These are essential markers that reveal inflammation, dysregulation, depletion, metabolic stress, and all of that directly impacts recovery. Third, support the system with food and nutrients. You don't need to become a nutritionist, but you can guide your patients towards stabilizing blood sugar, encouraging regular meals with healthy protein, a balanced diet, good fiber intake, healthy fats. You can recommend anti-inflammatory foods, and with the right guidance, you can introduce well-tolerated supplements like omega-3 fatty acids, magnesiums, methylated B complex vitamins that will support the whole brain and nervous system repair. And finally, don't forget to collaborate with your colleagues. If a patient is struggling with persistent brain fog, with GI symptoms, with hormone-related issues, don't just assume it's all in their head or it's all anxiety or it's just part of the process. Bring in other experts. maybe a functional nutritionist, a trauma-informed therapist, integrative primary care provider, someone that can help uncover and treat what you can't see in the standard chart. And these steps are not radical. These steps are responsible. They say to your patient, I see you, I believe you, there's more to the story about me. And they say to your patient that you want to get it right. And that level of care builds tremendous trust. And that trust is often the very thing that creates a breakthrough. So when we stop treating symptoms in isolation, we start looking at the structure underneath, we change the entire trajectory of recovery. And our patients stop feeling like they're failing. They start understanding how their bodies, their brains, their whole histories are shaping their behavior. They feel resourced instead of overwhelmed. They feel empowered instead of pathologized. And the work we do as clinicians becomes not just more effective, but really more humane. And that's what functional psychiatry makes possible. Not a new system, but a more complete story. One that honors complexity, respects biology, and creates room for real transformation. And if you want to go deeper, if you're ready to understand why relapse often happens even when things look stable on the outside, on the surface, and how to catch it before it hits, make sure you check out the next video. I'll walk you through exactly what to look for, how to intervene early in a way that supports your patients, rather than letting them feel shamed. Until then, keep practicing with purpose. See you soon.